Hello, this is Dr. Divakar Bhat, Cardiothoracic and Vascular Surgeon working at Aster RV Hospital, JP Nagar, Bangalore. Today I'll be talking about valve operations. So normally many will have a doubt, what is this valve, what is its function, why it gets diseased, and when it gets diseased, why only operation, why not other alternatives. So first I'll explain about the valve. Valve is nothing but structure in between two chambers which directs the blood flow in one direction. There are four chambers which basically deals with the blood flow. Imagine blood is in this chamber and it has to go to the another chamber. The valve opens, and when this chamber contracts, the other valve opens and the original valve closes. It is like a security guard, you can say, which allows the flow in one direction, and in the reverse direction it will not allow. This is a natural valve which is present inside the heart. There are four valves which directs the blood flow in a sequential way from one chamber to another chamber and goes on. It basically separates the pure blood and impure blood also. When these valves gets diseased, either it can lead to a constriction, that we call it as stenosis. Imagine the valve size has to be this much, and if it becomes like this, we call it as blocked valve or stenotic valve. And as I told, the valve function is to allow blood flow in one direction, and if it allows in the reverse direction also, then we call it as a leaking valve or a regurgitation. So when this happens, there are two options. One is repair, another is replacement. We surgeons try to do a repair whenever possible, because in the repair what happens is we try to preserve the native valve or his own structure. We try to retain as much as possible, and we try to repair that. The long-term results are better with this, and another main advantage with valve repair is you need not take any other medicines lifelong, because you are living with your own tissue valve, and we have done just small repairs, and as long as it functions well, you need not take any artificial medicines like blood thinners, all those things. But this is not the case in every patient, because all the valves may not be repairable. For example, the valve here between the left atrium and left ventricle called mitral valve is easily repairable, whereas other valves are not so good for repair like aortic valve. There are several surgeons try doing, but long-term results are not good. So when a repair is not possible, then we use a thing called artificial valve. These are the artificial valves. Whenever we use this valve, see, we basically remove that God-given valve, destructed valve, and implant this valve, which will allow the blood flow in one direction like this. So it opens, closes, opens, closes. So this is one type of valve, and this is another type of valve which opens and closes like this, closes, opens. There is no machine or mechanism in this. It just because of the pressure difference in between two chambers, it opens and closes. The problem with artificial valves is we will have to take the medicines lifelong, because this being a artificial structure, whenever the blood comes in touch with this valve, the blood becomes thick, or we call it as clot formation. So this being in the blood circulation, any clot on this can go to brain, can go to kidney, can go to limbs. If it goes to limbs, we call it as gangrene. If it goes to the brain, we call it as stroke or paralysis. So to avoid that, that person will need to take lifelong anticoagulation. But the advantage with this artificial valves is they work for ever. Compared to this tissue valves, the tissue valves usually works 10 to 15 years. So as I told, if it is repairable, repair. If it lasts long, we do a repair. If it is not suitable for repair, if the person is less than 50 years, we use a metal valve. If the person is above 60, 70 years, we use a tissue valve for various advantages, disadvantages I told. If you have still any doubts about this valve operation and valve material, valve choice, you can always contact us at Aster RV Hospital. We have a team of doctors, experts in doing this valve repairs and replacements, either with metal valve or tissue valve, through open technique or through a keyhole. So if you have any doubts, please contact us without any hesitation. Thank you.